Hello again, I'm Anthony Selm from the Modern Insurance Store. Today's question is a big question that many of you have as you start Medicare, and that is, can I keep seeing my current doctor with Medicare? It's an important question because your doctor knows your health history. Today, we'll explore how Medicare affects your choice of doctors. Let's clear up any confusion and make sure you feel comfortable with your health care as you transition over to Medicare. Before we dive into whether you can keep your doctor, let's quickly go over what Medicare covers. Medicare has different parts. Part A is mainly for hospital stays, and Part B is for doctor visits and outpatient care. Knowing which parts you have will help you understand if you can continue seeing your current doctor. Medicare works differently than most private insurance plans. It's a national program and it has its own rules about which doctors and hospitals it works with. But a big plus is that many doctors in the U.S. accept Medicare. It's important to note that if you choose a Medicare Advantage plan, also known as Part C, it might have different rules about which doctors you can see. We'll talk about this in more detail soon. Let's start by looking at how you can check if your current doctor accepts Medicare. The first step is to simply ask your doctor if they accept Medicare patients. Most doctors do, but it's always good to check directly with your doctor's office. You can also check online. The Medicare website has a tool where you can search doctors who accept Medicare. This can be useful if you need to find a new doctor or if you want to confirm your current doctor is in the system. If your doctor accepts Medicare, you'll typically be covered under Medicare Part B for most of your doctor's visits. Remember, with Original Medicare, you can see any doctor in the United States that accepts Medicare. Now, what if your doctor doesn't accept Medicare? Let's discuss what options you have in that scenario. If your current doctor doesn't accept Medicare, you have a few choices. You can continue seeing your doctor, but you might have to pay the full cost of the visits yourself. Medicare won't cover any part of the bill. Another option is to find a new doctor who does accept Medicare. This can be a tough decision, especially if you've been with your current doctor for a long time, but it's important to have a doctor that is covered by your insurance. You can use the Medicare website to find doctors who accept Medicare. You might also want to ask for recommendations from friends or look for reviews online to find a new doctor that fits your needs. What if you're considering a Medicare Advantage plan? Let's talk about how these plans might affect your choice of doctor. Medicare Advantage plans, or Part C, are a bit different. These plans are offered by private insurance companies and they usually have a network of doctors you'll need to stick to. If you're thinking about a Medicare Advantage plan, check if your doctor is in the plan's network. Each plan has its own network, so your doctor might be in one plan's network but not in another's. These plans can offer extra benefits like dental or vision care, but the trade-off is less flexibility in choosing doctors. It's a balance between the extra benefits and the choice of healthcare providers. Now, let's talk about some tips for transitioning to a new doctor if you need to. If you need to find a new doctor, the transition can be smooth with a little planning. Start by making a list of your health needs and any preferences you have for a new doctor, like location and specialty. When you find a new doctor, make sure to transfer your medical records. This helps your new doctor understand your health history and continue your care effectively. It's also a good idea to schedule a get-to-know-you appointment with your new doctor. This gives you a chance to ask questions and see if they're a good fit for you. Remember, finding a doctor you're comfortable with is key to your health. Take your time to find someone who meets your needs and makes you feel at ease. In summary, whether you can keep your current doctor when you start Medicare or not depends on if your doctor accepts Medicare and which kind of Medicare plan you choose. Always check with your doctor and consider your options carefully. If you have more questions or need help navigating Medicare and finding a doctor, we at the Modern Insurance Store are here to help. You can also check the resources available on the Medicare website or call their helpline for assistance. Thank you for watching this video. We hope it has helped answer your questions about Medicare and doctors. Remember, your health is important, so take the time to make the best choices for your health care. See you next time. Hey, thanks for watching. If you found our discussion helpful, please give us a thumbs up. Don't forget to subscribe and hit that bell icon to stay updated with our latest content. Your support helps us keep bringing you more informative videos. See you in the next one.